Kirby Institute is a great place to work. It's internationally recognised, certainly in the area of HIV research, but increasingly in other areas, hepatitis C particularly, other infectious diseases, sexual transmitted infections. It's really, I think, making inroads in a lot of infections, particularly that affect marginalised populations. And the endowment that Lynn Joseph has left will contribute to a project that I'll talk about that really is about providing opportunities for people who are affected by hepatitis C to access incredible new treatments. And just to give you a bit of background about hepatitis C. So hepatitis C, for those who are not aware, it causes a chronic viral infection, infects the liver. A proportion of people, probably about 30% of people, will develop very progressive liver disease and develop cirrhosis and be at risk of liver cancer or liver failure. A large number of people in Australia have hepatitis C, about 230,000. We have an increasing burden of advanced liver disease complications with several hundred people dying every year from liver cancer or liver failure. And we've been struggling with the treatments to date, which have been suboptimal. They've been based on injections, interferon injections once a week and tablets of ribavirin. We've been using those treatments for a decade or so with some modest benefit, but very low treatment uptake, only about 2,000 or 3,000 patients coming forward for those treatments every year. The Australian government last year set aside $1 billion to make these revolutionary new therapies, antiviral therapies that specifically target hepatitis C virus, available to all people living with hepatitis C. Australia is one of the only countries that has such a broad program. Most countries haven't been able to negotiate the right prices to make these drugs available to the broader population living with hepatitis C, but the Australian government has done an amazing job in doing that. One of the other foundations for the Australian, what we call direct-acting antiviral program for hepatitis C, is that not only did they make it available across the spectrum of liver disease, whether people had serious liver disease or early liver disease, but they also enabled all registered medical practitioners to be involved, if they wanted to, in terms of prescribing these new therapies. Most countries around the world have treatment only delivered through specialist clinics in largely tertiary care. And I think one of the keys to the Australian success, and many countries around the world are looking at Australia in terms of how we've been able to get this package in place, is that we're able to get general practitioners involved and other clinicians involved in terms of care for people living with hepatitis C. Because of that breadth in terms of prescribers, in the first 5 months of the program, which started in March, Australia's initiated 26,000 patients on treatment out of the 230,000 living with chronic hepatitis C. That's the most rapid uptake of one of these programs internationally. And I think the ongoing success of that program will very much depend on getting general practitioners involved, engaged, upskilled, and really part of the treatment sort of program. So the endowment that Lynn Joseph has left will contribute to a program that we're developing at the Kirby for online consultation between specialists and general practitioners. At the moment, general practitioners do need to have a consult with a specialist. The patient doesn't need to see the specialist, but there needs to be an online or remote consultation. So we're developing a system that will enable that to happen. At the same time, we're developing a national registry of treatment outcomes that will look at treatment outcomes not just in tertiary care, but importantly in primary care, in drug and alcohol services, in prison-based clinics as well. Hepatitis C is an infection that, as I said, affects marginalised populations, predominantly people who at some stage in their life have injected drugs. So I think David talked about opportunities. I think this endowment really does give us the opportunity to make some inroads in terms of improving the access that has been great in terms of the first 5 months of the program. And I think to upskill, engage with general practitioners. And I think general practitioners, by the nature of the understanding that they have of the whole patient, so to speak, rather than through a narrow sort of framework, are ideally suited to the care of people living with hepatitis C. And Lynn Joseph was a general practitioner in the Maroubra area for many decades. And I think that community-based involvement in terms of provision of care and access to these revolutionary new therapies will be wonderful to watch as it rolls forward. So just once again, very thankful for the support that's been made available. Thank you.